Hi, I'm Jeff Okamoto. I'm a developmental behavioral pediatrician. I have a couple of roles, which actually I guess makes it a little bit hard, but I'm on the University of Hawaii faculty to teach a lot about development, both normal and also when things go awry. Right now I'm actually a Kennedy Fellow in Washington, D.C., so I'm sort of studying on how the system works in terms of legislative and agency type of work around people with developmental disabilities. I got into the field because I was very interested in how kids develop, and I actually always had a lot of enjoyment just seeing that process, not always understanding why kids learn what they do, when they do, and how that all works. And what was interesting in my pediatrics training, I started to realize that parents of kids who were not developing well needed quite a bit of support. They were usually pretty distraught, I think, about how things were happening, especially early on when they just start to figure out that their child might be having some problems or running a little bit behind on developmental areas. So what's funny is I felt like, well, that's an important need that needs to have some supports and work. So I ended up going into the field of disabilities. What's really interesting, I think, about that is that I was interviewed for my pediatric residency, and I remember this one interviewer said, why did you go into pediatrics? And I was talking about how, I like working with kids, I like working with parents, and they seem to get better. And that was a very happy thing, helping kids get better, and parents are happy. And he goes, well, what if they don't get better? What if they have a problem that's ongoing? And I really actually was taken aback by that, and it's kind of ironic in the end that I am pretty much taking care of most of the kids I take care of don't have problems that go away. They continue to manifest themselves over time and tend to be chronic. And I really enjoy it. It's really been probably one of the most fulfilling parts of my life is to work with families. But now I'm sort of getting into, I think, a lot of policy things and realizing that at certain levels you can affect many more people. And I'm happy to be on a project where we're doing a curriculum trying to take care of adults with these issues. I think we're at the level where we're trying to produce a curriculum that will affect many, many training programs, and hopefully a lot of doctors who will end up being the future providers of all these people that require some support. I think it's pretty interesting how I got a little bit more into public policy and sort of this level of thinking. My current Department of Health director came up to me one day and said, Jeff, I don't know who you are, but I heard that you work with people with developmental disabilities, and we need a lot of help with that. We're having a lot of lawsuits in our Department of Health agency, so a lot of them have to do with medical things, so can you help us? And when I said yes to that, I ended up contracting with that Department of Health agency for 3 years, and now I'm their medical director. I actually didn't realize that I was going to be taking care of 3,000 to 4,000 adults with developmental disabilities, and my training is in pediatrics. And so I tend to feel much more comfortable when they're kids and I'm working with the parents, but once they become adults, I always figured, I will transfer their care, and now I'm sort of in the middle of really being part of the sort of looking over how adults with developmental disabilities are being cared for, and realizing there's a lot of issues with that. And I'm not an internal medicine doctor, or I'm not a family practitioner, which they tend to be the ones taking care of them when they become adults, and really seeing a need for that to improve in terms of knowledge as well as the skill base of those physicians. So I'm really happy to be part of any kind of initiative to help the physicians who are actually doing all the lion's share of the work with adults with developmental disabilities, happy to be supportive of that.